korenda bago komanya tu ayalengete ebinyenye bigabye nyamoreo gati abanati ko komanya carbon gas sense ya Kenya bantu weka ebirengo bi milioni ya mochinu gutainyen nigo babwato burairo boiga bwa enyamoreo nabo igo gati yabaga 1.4 million na ababwata niboka gose abakenya milioni ya mochinu gutesa toboka baroba ko tumeka mario gari ARV korenda iga babanda baga 1100 mbali gutumeka mario ga ibo korabwata kana no robatu abwato ko bwango iga aba bali bagande gutumeka gose gwe carbon iga botumeki bw'emipira iri korenda oyo mogotanya oro mochando iga na gutanya oro imyinye biga nigo mente kiro botumeki wani gwa mente kiro gwika ibirengo bya 14 igoro yemya nabigo carbon iga bali bagande bamanyirenge mangana yo mariogo na roro yo korenda binyinye biga nigo biregwe kebirengo bya 90 chinu gutaisa 95 na ibere nabigo carbon iga ense ya Kenya nigo ya kire birundo kigma kwene kyanga weikase birengo bya 94% nigo bakorwania ebinyinye biga bye nyamoreo igo mwanchumuriri ngo tuzukurania ya masemo ikasumuchi ona Nairobi korwa segeti kya Nyayo Stadium asubego muwaziri bo mangarale yo bachino kiga sense ya Kenya daktari baraza nigekirana ya mase ya Modebora baraza nigekirana ya masemo igo kurigerere litukeliga ya mangarale ngete enyamoreo ensengema.
Immense pleasure to join you this morning to commemorate 40 years since the first case of HIV being detected in Kenya in 1984. This World AIDS Day is special to me as the celebration is critical to shape our discourse for the now and future generation who may have not had the chance to see and experience the epidemic in its worst case. We all recall the experience on our continent, the early 2000s, a negligible number of HIV-positive clients had access to diagnosis and life-saving treatment. On the health facilities, they were swamped with dying patients and doctors struggled to give their best to manage the onslaught of devastating opportunistic infections. Homes were filled with graves, orphans who were helpless filled our communities and our country, and all sectors lost a significant workforce, and the stigma in the communities was at its highest. It was devastating at that time, even as was said by Dr. Rose. HIV and AIDS crisis that threatened the social, economic, and development fabric of the country, and the emergency situation called for out of the norm action. The ravaging epidemic at that time threatened to wipe out communities if nothing was done, and done very fast. The Kenya government declared HIV/AIDS a national disaster in 1999, resulting in a national move towards creating awareness and advocacy for prevention of new infections. And globally multilateral investments through PEPFAR. Thank you so much, Brian and your team, and really we appreciate the great work and for standing with us throughout this. I have seen practically, even working in the HIV programs, what you have done, and we really appreciate your support, and equally for the Global Fund, who are really instrumental in terms of supporting us to reduce the HIV infections in our setting. Since 2003, the government and its partners have built the essential mechanisms for HIV/AIDS management and strengthened public health systems, which we even leveraged on during the COVID-19 pandemic. And I want to assure Kenyans and partners